Hello, everyone. Our presentation will be on the hepatitis B virus. I'm Lauren Jacobsen.
I'm Corby Johnson.
And I'm Scottie Pulsipher. Welcome to our video presentation.
To begin things off, let's talk about the significance of this disease in our society. In 2016, 14,847 cases of chronic hepatitis B were reported in the U.S. Although that doesn't sound like much, it is still too much given that there is a vaccine available. In 2015, hepatitis B resulted in 887,000 deaths worldwide. 1 in 20 Americans have been infected with the hepatitis B virus, and that's around 15.6 million at some point in their lives. Up to 40,000 Americans will become newly infected each year. More than 2 million Americans are chronically infected, meaning that the disease has progressed past its dormant or asymptomatic state and affected the people involved. Thousands of people die each year from hepatitis B, and it's usually through liver failure.
The official binomial name for the virus is the O-throw-hepatinavirus HBV. The HBV stands for hepatitis B virus. The virus itself has a lipid envelope for an outer covering and an icosahedral or 20-sided protein capsid core. The core contains the viral DNA and the DNA polymerase protein.
The DNA on the inside of the icosahedron protein capsid is actually partially double-stranded and partially single-stranded. By the time the virus infects a host cell, however, it is completely double-stranded. These host cells are hepatocytes, which are the cells of the liver. T cells break down the liver cells that are infected with the virus when there is an immune response by your body. Doing so wouldn't normally be a problem, but the prolongation of this action causes cirrhosis of the liver, which is synonymous with the hardening or scarring of the liver cells. The cells become tough and cease to function normally, resulting in liver failure.
The process by which the virus replicates is a little complex, but understanding this is really important to understanding how the virus causes the symptoms that it causes. Once the virus enters the blood, it travels to the liver, where it finds liver cells, or hepatocytes. First, the virus attaches to receptors on the liver cell. This attachment tricks the cell into bringing the virus into the cell by way of endocytosis. The viral lipid envelope helps this process by fusing with the host cell's plasma membrane and ejecting the protein capsid into the cytoplasm of the cell. The cell then transports the capsid to the nucleus, where it sheds its protein coat. At this point, the viral DNA is modified to be completely double-stranded so that it can be transcribed into RNAs by the cell's nuclear proteins. A part of the new viral RNA is incorporated into the host cell's DNA by the reverse transcriptase protein that the virus brought with it in the capsid. The integrated DNA will then be used to make a huge amount of copies of viral DNA, protein coat, and reverse transcriptases. The DNA and reverse transcriptases are then inserted into protein coats by the cell. Eventually, the cell dies, breaks apart, and spills out the many copies of the virus to spread to other nearby cells. This leads to a cascade of cell infection and death in the liver. This and the body's subsequent immune response is what causes the many symptoms of the disease. The liver is responsible for both filtering out contaminants and dead cells from the blood, so I'm sure you can see how the destruction of enough liver tissue can cause severe symptoms and even death.
The virus doesn't always proceed straight into replicating right after incorporating itself into the host DNA. It can simply stay within the DNA of a cell or float through the body without invading a cell. The reservoir is pretty simple. Humans are the normal reservoir, like many viruses, but unlike many viruses, chimpanzees are also susceptible to hepatitis B. Reservoirs for this virus are considered non-zoonotonic.
The transmission is via the bloodstream and is not spread via the fecal-oral route. It's by direct bloodstream contact. That includes when infected blood enters the body of someone who is non-infected, contact with semen, vaginal fluids, or saliva, contact with unsanitized needles used on those with the virus previously. The virus can be transmitted through a break in the skin or mucous membrane of the body. Accordingly, it can spread from host to host or from reservoir to hosts through simple means such as sharing a virus-tainted toothbrush while having an open cold sore, having unprotected sex with an infected person, sharing needles, having a tattoo or piercing done with a dirty needle. An infected mother can also give it to her child during birth. It can also be spread by other means that are less common or are more isolated, such as blood transfusions or an injection site. Hospitals are notoriously up to date on having all staff vaccinated with the complete assortment of hepatitis vaccinations for that reason.
There are a lot of signs and symptoms for HBV. Some of these symptoms include abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea, and vomiting. The tricky thing about this virus is that it usually develops 1 to 4 months after infection. To make things easier, if you were to remember one symptom of HBV, you should remember jaundice. Jaundice is something that really distinguishes this virus from others. While doing research for this virus, I read about babies who actually are infected with this virus during childbirth. If a mother already has this virus, there is a high chance of infection between infected mother to baby. We previously talked about how the HBV is transmitted by direct bloodstream contact. Well, that is why it is so common for babies to get this virus during childbirth, because there is so much blood involved in the process. This mom-to-baby infection is why vaccinations 12 to 24 hours after birth are given to the baby. This vaccination reduces the chance of infection by 80 to 95%.
There are many ways to prevent HBV infection. Some of these are medical, but a lot of these solutions involve lifestyle choices on the part of the individual. In terms of medical prevention, there are a couple of options. Firstly, there is a vaccine. It has a few names. Mostly it's known as Universal Hep B or simply Hepatitis B vaccine. That's also known by its trade name, Recombavax HB. It does need to be taken in a 3-dose series or it won't work, however. Secondly, those who might have been in contact with the virus can also receive a HepaGam-B to help prevent the virus from developing into an infection. There are also many non-medical ways to prevent the illness. Safe sex practices, knowing the infection status of any sexual partners, getting screened for the virus, and being careful about where you get tattoos, piercings, and medical care all help prevent transmission. Because the HBV infection can be acute or chronic, treatment can vary quite a bit from person to person. Usually those with top-notch immune systems will only have to suffer through the acute version of the disease, so a lot of treatment revolves around strengthening the immune system and would probably fall into the category of prevention rather than treatment. Those who end up having the disease chronically can still be treated. Many of these treatments can be risky for the infirm, however. If liver damage is extensive enough because of the virus that the liver begins to fail, then a liver transplant may be necessary for survival. The transplant can be risky and may not prevent the infection from returning. Patients are usually asked to avoid alcohol while infected, as alcohol puts additional stress on the liver.
Before the virus was well understood, blood transfusions would sometimes spread hepatitis B infections from the blood donor to the recipient. Today, blood banks and plasma centers test donors regularly for the virus to prevent transmission. It was recently discovered that the mysterious hepatitis B portion of the viral DNA may indirectly cause liver cancer by disrupting the cell's ability to stop division.
So I want to share an experience about my grandfather. He actually received a liver transplant that was mentioned in the previous slide. He passed away about 3 years ago, but around 13 years ago, his life was extended 10 years by the liver transplant. He received it from my uncle. He was at the time, it was the 6th liver transplant in the nation. It was given to him as a result of then perceived imminent liver failure from cirrhosis of the liver. He contracted the disease when he was given a blood transfusion years before that transplant. That blood was unknowingly infected with the hepatitis B virus, which is why it's important, when Lauren mentioned that donors regularly test the virus to prevent transmission. It was years after the infection that he noticed health complications related to his liver. Interestingly enough, medical professionals in and around the 70s and early 80s had little understanding of bloodborne diseases and shared blood freely without proper screening. This was around the time that my grandfather got infected. This goes to show that modern advancements in medicine have saved many current and future lives, and that a virus can be silent and deadly. Having said that, I stress the importance of receiving your vaccinations, as it could save your life.
Thank you for enjoying our presentation.
Thank you.
Thanks, guys.